The most effective weight loss treatment plan for many patients is bariatric and metabolic surgery. Here at Norman Regional's Journey Clinic, we promise to prepare you for the road ahead, arming you with the information you need to ensure you're ready, physically and mentally, for a life-changing bariatric procedure.
Journey Clinic is a comprehensive bariatric center, and we offer multiple options for patients no matter where they are in their weight loss journey. We recognize that obesity is a disease process with multiple contributing factors, and so we will work with each individual, meet them where they are, and find out what is the best option for them in terms of weight loss.
The comprehensive care at Journey Clinic includes extensive preparation and lifelong follow-up, weight monitoring, nutrition counseling, psychological assessment, and physical therapy. You'll start your journey with a bariatric navigator. A patient advocate will walk you from start to finish. Your bariatric navigator will help with the insurance process to make sure you meet all the requirements of your insurance provider before surgery.
It is important for patients to understand that this is a lifelong partnership in treating their obesity, and that we are here for you for the duration. I still have patients that are more than 10 years out from bariatric surgery that come back to see us on an annual basis.
The team at Journey Clinic specializes in state-of-the-art bariatric surgery, including gastric sleeve, gastric bypass, and duodenal switch. The skill of our surgeons is just one reason Journey Clinic is recognized as a comprehensive bariatric center by the nation's leading accreditation organizations.
Many patients feel like they know what the best option is for them. It's my role as a clinician to look at the whole picture of the patient and find out where your struggles are, and to find out what your specific health issues are, what other things may come into play as far as medications.
All of the surgeons at Journey Clinic perform minimally invasive surgery, which means with very small incisions. That can be laparoscopic or robotic. They're very similar in that way, that it's with small incisions. So patients get to recover much faster. Their scars are smaller, obviously. They generally have much less pain. The gastric sleeve is a surgery where we remove the majority of the stomach permanently from your body. We create essentially a banana-shaped stomach from a football size. So not only do people feel full faster, they also feel less hungry because there's a hormonal change that happens when you remove a good part of the stomach. This operation is extremely safe and very effective. It results in generally at least a 50 to 60% excess body weight loss. The durability is also very good. Patients do very well keeping the weight off, especially if they check in regularly with us and if they're exercising regularly too.
We create a small pouch out of the stomach, so it holds roughly about the size of an egg or a golf ball. And we connect that pouch to essentially the middle portion of the small intestine. And so we are essentially bypassing most of the stomach in the beginning of the intestine. So the rest of the stomach is still functional, still producing digested juices. It just won't reach your food until a much later point.
Duodenal switch is a combination of both sleeve surgery and bypass surgery. The procedure begins with the creation of a gastric sleeve. Next, the small intestines are rerouted, similar to gastric bypass, reducing the amount of calories absorbed.
For people who have severe type 2 diabetes, or even for patients who are on large amounts of insulin or who have had diabetes for many years, then this may be the procedure of choice. It is also one of the most effective procedures for patients who have a body mass index over 50. And there is a unique group of patients who have a body mass index over 50 and may think about the gastric bypass, but they're also dependent upon anti-inflammatory medications for their joint pain, for their hips, for their back. And those medications don't do well with people who have gastric bypass because there's an ulcer risk there. They can take it safely with duodenal switch.
Here at Journey Clinic, it is our promise to walk with you on your weight loss journey. And for some patients, that includes a revision operation,
which are things like taking out lap bands and changing people to other operations, or otherwise kind of revising or fixing previous surgery.
In order to prepare for weight loss surgery, Journey Clinic patients must be up to date on all screening tests, colonoscopy, mammogram, and pap smear. Bariatric candidates are required to quit smoking tobacco and stop all alcohol consumption. Regular exercise is encouraged, and so is attendance at Norman Regional Bariatric Support Group.
People find a surgery buddy on the support group, and so they find each other in the hallway when they walk on the unit after surgery. And then they continue to have that support after surgery to have success.
Your journey to surgery will include comprehensive consultations with your surgeon to make sure you understand every aspect of your procedure and life after bariatric surgery. The standard of care at Journey Clinic includes a consultation with a psychologist, a registered dietitian, a support group, and physical therapist. After surgery, you can expect to meet with the team at 2 weeks, 6 weeks, 3 months, 6 months, and yearly after that. The Journey team will be in constant contact to monitor weight and nutrition. Psychological, physical therapy, and nutrition experts are available to you anytime you need help.
We're here with dietitians and our physical therapy and our psychologists, and it's a multifactorial disease, and so we have a multifaceted team to help forever.
No surgery is risk-free. The risks with bariatric surgery are unique. Early risk includes bleeding, infection, damage to surrounding structures, blood clots, pneumonia, and death.
Risks can present themselves both in the immediate post-operative stage while people are in the hospital, and they may present at later points in the patient's recovery as well.
Longer-term post-operative risks include vitamin deficiency, ulcers, hernias, reflux, low blood sugar, and bone loss. Many of these risk factors can be avoided when patients are consistent with their scheduled long-term follow-up appointments at Journey Clinic.
Bariatric surgery is not just for weight loss. A lot of patients have medical problems that are associated with their weight. So a lot of these issues start to improve very quickly after surgery. Things like diabetes, joint pain, and then even long-term things like cancer risks go down. Patients can be more active.
Patients who refrain from smoking, don't take NSAIDs, and follow instructions to take vitamins and to exercise regularly may also avoid negative outcomes of their bariatric procedure. Many of our female patients are concerned about pregnancy after bariatric surgery.
It's definitely safe to consider pregnancy after bariatric surgery. There are some instances in which surgery actually helps a woman achieve a better health. So pregnancy may be safer after bariatric surgery, not just for the mother, but even for the baby long term.
Patients are advised to use reliable and consistent birth control methods for at least 18 months after surgery.
One thing we do ask is that you wait a minimum of 18 months after surgery. We want to ensure that your weight loss has completely stabilized and that your nutrition is stabilized.
Each of these bariatric procedures has advantages and disadvantages. There are risk factors and benefits. For all types of weight loss procedures, it's important you talk with our team of medical professionals about the procedure that's right for you.